This panel is challenged. We're the first one after lunch. I plan to keep this sort of somewhat interactive. I think I have the privilege of being the only adult ESL teacher in the room. Is that true? Can I show of hands? Hello. Hi. Yay. Okay. First of all, I have to thank Alicia Fernandez because of her invitation I'm here, but my thank you really goes back about almost 20 years to Rima Rudd, who, had I not crossed paths with her at the Harvard Graduate School of Education, I would have not adventured across the river to the School of Public Health, and even though I was getting a doctorate in literacy education at the time, my work with her public health projects has really transformed my life. So currently in my job, I spend 80% of my time training ESL teachers. So what was wonderful about the panel before lunch, when you heard about challenges around making things simple and making things understood, building relationships with community, that is the science of education, or the art of education. We are talking about pedagogy. We are talking about how people learn new skills, how people gain new knowledge. And so one of the things I'd like to talk about today is titled around language access. There's basically two takeaway messages. We should be spending more time with the adult literacy world in public health, and public health should be spending more time in the adult literacy world, vice versa. The bridge goes both ways. And the second thing is that it's never just about English, which I think you've already heard multiple times over. It's about what we would call in education this idea of message abundancy. So one thing I would suggest as a teacher trainer is we stop saying we're trying to make things simple, because it sounds a little infantilizing. What we're trying to do is make ourselves understood, and that is the goal of the teacher. If we went in every class and said, I'm just going to make things simple today, I don't think we would motivate our learners to come back tomorrow. But if we said, I'm going to find out what I plan on teaching today has an intersection with what you need from my class today, then we can have a conversation about where learning takes you. So I do spend a bulk of my time training teachers. Many of my graduate students are interested in connecting English language education with the world outside. Right now, all of our funding, or a large part of our funding, comes from workforce training. So one of the important discussions we should have as a follow-up always is how, in fact, should there be no trade-off in the way funding is coming into adult ed, so that we're both addressing workforce development needs, which is where our administration's head is right now, and has been for quite a while, and how we can also meet some health literacy education needs as well, and empower the immigrant communities that I think you've been talking about all morning. I'm going to start in the classroom. So to kind of give life to what happens in adult ESL classrooms when you hear about people doing health literacy curriculum work, I want to give you a little bit of a snapshot of what that might look like. And then I'm going to tell another story from the perspective of adult learner leaders. And it's unfortunate that Julia left. I wanted to have a longer conversation with her, because many of the things she talked about speak very much to where are the learner voices, where are the immigrant voices, where are the immigrant learner advocates in this conversation alongside of us who are both policymakers, researchers, and directors. So let me start here. This is a story. We took it from a health text, and the teacher I was working with turned it into some reading material, some discussion material in his ESL class. This was here in Oakland, in a public school where the mothers and a few fathers would drop their children off at the elementary school, and then they would go to class for a few hours in the morning. So I'm going to read you about this, and it's good we just had lunch, because this keeps that theme going. It's called Pozole, the Pozole story. You don't think about vegetables because you never ate enough meat in your country. You think that the best and most delicious thing is to prepare a very delicious pozole. Raise your hand if you've had pozole before. Good, a lot of schema in the room. So it's a stew, there's a lot of meat. There are some vegetables which typically get presented as condiments. And that is where this story gets very interesting in the ESL classroom. We introduced this story, I was working the ESL teacher, to talk about ways that we can bring in themes around child nutrition, changing diets in immigrant families. How can you preserve home traditions in a new area that you're living in? How can you bring that together? That was the content of the class. And we were working with some public health folks who wanted to get some child nutrition guidelines out into the community. So one of the things we do is to think about how these texts become the basis for language learning, also content learning, learning about child nutrition guidelines, but also become the text for learners to be able to tell their own story and their own healthcare concerns. We have this model I won't go into very deeply right now. It's called the restoring approach, where you take a given text, you modify it so that it's accessible to the learners, but you go through these stages where you describe what's in the text, you build some interpretive skills, but then you give the learners an opportunity to re-story it, which is by asking these questions. Does this story remind you of your own? Who should hear this story? And how should we share these stories if we have new ones? So I show the story again because the image that often came to mind for many of the learners was largely a meat dish. And that's where it got interesting. And I'm showing you a bit of a transcript excerpt. This is, as an applied linguist, this is what I do. We listen to great classroom talk. We go home and we write it up and study the heck out of it because we're interested in the way meaning is made with language. So Clara is a student. The teacher is the teacher. So Clara says, the pozole has vegetables in the top. The pozole has good vegetables on the top. The teacher's a little confused. Are you asking me a question? Or Clara says, no, 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 no. I say. She's saying, no, 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 that's my opinion. It's not fair to call pozole a meat dish. There are vegetables in pozole. Clara goes, and she's saying that she disagrees with the text we just read. This is a contradiction because she said Mexicans no like the vegetables, and the pozole has vegetables. No understand this point. This is a marvelous moment for an English teacher because you have a beginning adult ESL learner disagreeing with the text in the classroom. That implies two things. One, they understood the text. Two, they understood enough to disagree with it. And three, holy grail, they're actually expressing in English something in reaction to it. Imagine that dynamic in a clinical encounter. So here's what's going on. Clara's thinking on the left is what people should think pozole is, and she's getting a sense that the text is projecting the image on the right. She gets in a somewhat heated argument with another student in the room, Alicia. Alicia says, that's not vegetables. No es vegetables because it's only a little cabbage or lettuce or the radishes, poquito. Clara says, pero ¿qué son entonces? Well, what do you call those? If those aren't vegetables, what are they? Alicia says, sí, es vegetables. No es same to eat the broccoli or cauliflower. It's not the same as eating a head of broccoli or cauliflower. Clara replies, pero es vegetales. What's the difference? Alicia says, espinaca is different. Sorry, that's a spelling error. It should be espinaca. Vegetales for me is different. Es, no sé, I don't know. And she gives up, and it ends. The other thing you need to know that there is a table of all predominantly Spanish speakers, but around them is a table of Yemeni women who have said nothing during this discussion. And there's also a woman from South Korea who was vigorously nodding her head because they had just had a potluck the week before, and she's saying, there is no vegetables in pozole because I ate it. At which point you hear Alicia say under her breath, she's had pozole once at a potluck. What does she know about pozole? So we're trying to keep up with this conversation. Let me stop it here. What do you notice in just this short excerpt? What do you notice about this conversation? Yeah. So different schema about maybe nutrition. Okay. Other things? Anything about the language itself? Combination? English and Spanish? What do you think about that? Communicates well? I get one of two reactions to this. One is the learners were so animated, they had to switch to Spanish because they ran out of English. They couldn't say it, they couldn't express themselves, so they switched to the language they could argue more vehemently in. The other perspective is that, no, they're not actually code switching, because that's why I told you there's many women in the room. Because if they were really thinking about everybody else in the room and performing for everybody, they would have stayed in English as best they could. So this perspective of what we're able to communicate is, in what language are you health literate in? is one of the questions that come up, that both languages are absolutely necessary. So my graduate students, when I teach them this, before we've really talked about the role of L1, first language, and second language acquisition, they say, oh my gosh, we have to set down rules, English only. They should try harder to say it in English so that we can practice our English. Thank you. That's at 5 minutes left or 5 minutes? Okay, thank you. So let's stay longer in English to keep going. There's a newer view that they are not, and we don't call it code switching anymore, which just acts as if there's a choice. We actually call it translanguaging. Don't have a lot of time to go into it, but it raises the idea that health literacy, despite 3 or 4 decades of research, should actually, when we talk about health literacy among immigrant and refugee communities, as a multimodal, multilingual competence. We're not there yet in our research, but if you look at what's going on in classrooms where people are developing this competence, you do not see it demonstrated in English only. And so that, just to leapfrog ahead, that has a very important implication for how we assess the development of health literacy and its outcomes if we're only able to do it largely in English. This great moment of Clara where she challenges, pero que son, what are those? Is a direct challenge to, well, what is the public health world telling you is a vegetable? And that's such an important point of departure, because from a nutritionist's perspective, that may seem like a very rudimentary, banal conversation to have. Here, this is engagement. This is what we call engagement with the text, engagement with the meaning. This is the second story I want to tell. We just lost a great figure in adult literacy, Archie Willard. He's the head of a learner leadership organization in Iowa that cultivates leadership among learners who are developing skills and putting them at the table with policymakers and program directors. I want to tell you a story that about when I first met him. I was giving a talk to a bunch of adult learners, and similar in a room like this, and we were going to talk about what we knew about reading and how it connected with health. And he pulled me aside and he said, you're going to ask questions like, what do you think about this? What do you think about that? And the students are going to start talking, and they're going to start telling you their life story. And I know what you're going to think. You're going to think, that's not the question I asked. Do not interrupt them, he told me. He said, I know it's going to take time. We only have a certain amount of time this afternoon, but do not interrupt them. And his point was, learners, in order to become leaders, need uninterrupted opportunities to tell their life leadership story. So that question that Julia had earlier about how they learned how to tell their story and take notes, that's a beautiful recognition that what does it take in order to gain voice as a health literate person in this world requires opportunities. I'm going to skip by this. Not only to tell your story, the right to speak, it's actually better framed as the right to impose listening on others. That has such important implications for patient engagement, but also in classrooms where we try to do a very active job of allowing ourselves to listen as best we can, despite the comprehensibility of an accent, despite the fact that this person doesn't have the right vocabulary. Can you impose listening on other people? Another tenet that I think comes up in the Pozole story is you need opportunities to ask questions, even risky ones. It's not cool to walk into Safeway and hold up a carrot and say, hey guys, is this a carrot? Is it really a vegetable? When do you have opportunities to question these public health messages that you are being given? We're really good at that in adult ed. We actually love that. We love sort of the rebellion that comes up when they don't like materials, because it suggests a level of comprehension that is not ordinarily provided. This may be already clear. Proficiency in English never equals success. For any of you who have had difficulty with your health insurance, you know that to be true, because you speak English very proficiently, but you can still have challenges. And then I've made this point, that it's actually a multilingual, multimodal competence. I'm going to end soon, but I want to make an appeal, and I hope we can talk about this more, that Rima has been calling for this for about 30 years, that adult ed needs to spend more time with public health. Every single speaker on that last panel I heard pedagogy. I heard questions of pedagogy. And so I imagine the kind of conversations that need to be happening. So I have sort of the magic wand question about what we want. 3 things. Training. Teacher training is happening in universities. Health educator training is happening at universities. Those programs need to be speaking to each other more often and need to be incentivized to do so. We're both very silo-wise because we have our own licensing expectations with very little connection. New ways of thinking about health literacy credentialing, and I mean that very concretely. There are no certificates when an adult ESL learner completes, let's say, 3 years of ESL class and actually is better at healthcare navigation. You can fill out a form, you know how to make a doctor's appointment. There's no way to communicate to anybody that you do those things well besides just doing them. The one place in our adult education system that we're really good at credentialing is the prison system. We design classes that for every 6 or 7 classes you get a credential, a certificate. I wish we had something like that in adult ed for health literacy, because it would enable us to not only demonstrate linguistic outcomes, do they have better vocabulary, but do they also have better self-advocacy skills? We in adult ed are really good at that. We're good at talking about assessment. We don't necessarily have the connection to public health to translate that into the healthcare context. And then the third piece goes back to the learner leadership piece. Where are the adult learners in our conversation? A lot of this community organizing, I think that dynamic preserves a place at the table for the least proficient in the room. And that's what Archie Willard taught me, that it's our job to stop interrupting. Whether you come from the academy or you're a policy maker, is to stop interrupting the conversation that's so desperately trying to be heard. I hope we have a great conversation about adult ed, and I hope all of you can at least identify 3 or 4 adult ed programs that you're going to call on Monday. Oh wait, today's Wednesday. Next Monday. Thank you.